Good morning. As a leader suggests, there are just a lot of questions being asked about why would we be proceeding down the path today to pass this trillion-dollar overhaul of our healthcare system. And one of the instructive points is to look to see where the bipartisanship really is on this bill. And if you look at it, the bipartisanship is in opposing the Democratic bill on the floor. Here's the first 21 Democratic votes that are going to join us in opposition of the Speaker Pelosi's bill. And I am sure there will be many more Democrats than just this 21 that will be voting in opposition to the Democratic bill. I believe that's the case because many members on both sides of the aisle are listening to the voters who spoke last Tuesday in Virginia, New Jersey, and across this country in local elections, state and local elections. The message was simple. People have a grave concern about what Washington is doing to them, not for them. And if you look at what goes on the floor today during this health care debate, there are two very distinct visions of the way forward for this country as far as health care is concerned. There's one version, as the leader just pointed out, represented by the majority's bill, which will put the government between patients and their doctors. The Republican version, which won't. There's one version that will impose higher taxes on small businesses while we're expecting them to create jobs, and there's a Republican version that won't. There is one version that will be a massive overhaul and remake the health care that we know into a system that we don't. And there's another version that takes a much more reasoned and smart approach to preserving what works in the system while trying to address what doesn't.